Locally owned and operated as part of our community since 1997. Gateway Medical. Gateway to the Hunter. Accredited laboratory providing drug test training and on-site testing. Importer and national distributor of testing equipment. The biggest provider of nursing staff to aged care and major facilities in the Hunter.
Hi, my name's Tara. I'm an endorsed enrolled nurse and I'm currently in my third year of my Bachelor of Nursing with Charles Sturt University. Whilst doing that, I'm also studying an associate degree in dementia with the University of Tasmania and I work for All Staff Health.
My experience with agency nursing is a really good experience. You get to choose your own hours, a lot of flexibility. If I don't want to work in a particular venue, I don't have to, and the places that I really do enjoy working, I can choose to go there.
I decided to be a nurse at the age of 10 when my grandfather got sick, and I felt that I wanted to do that for a career, so I worked towards that. Started nursing when I was 17. Was very timid at first, but soon realised that you had to actually learn how to communicate effectively with people, and I love my job.
I joined the agency about 10 years ago. In fact, my wife, who's a registered nurse, joined with me because we were at a stage in our life where we didn't need to work full-time anymore unless we had bills to pay. Flexibility with roster was very important to us with children and grandchildren, and you know, you don't have to fight for time off when you need these things.
I've always had good experiences. You get to go to different places and meet all different people and different patients.
Here at All Staff, we offer training to our nurses through a number of different ways. We are currently partnered with the Australian Federation of Nursing to provide online training, which covers all of the mandatory education which our nurses are required to do.
So I chose agency work mainly so that I could spend time with my family and choose the days that I worked around my family. I have a little girl, my dad's sick, it just made more sense.
Treated very well when we turn up to a shift, generally, particularly when I choose where I want to go. They treat me very well.
A lot of the staff are very happy that they can fill the shifts. Everyone's really lovely and I feel very comfortable asking questions. Sometimes some people aren't really happy with change, but that's okay. I generally win them over with a big smile.
Structural adjustments to roles and duties, such as task shifting, is identified as providing significant improvements in productivity. It is acknowledged that reforms are the most difficult to implement, as changes are far-reaching and require cultural as well as structural change.
Whenever we turn up to a shift, I find that the nurses that I'm working with are always polite, friendly, and since I tend to work in the same spot regularly, they've gotten to know me, and socially they're friendly, chat with you, ask how your family is, and you actually feel like part of the team even though you know that you're a casual.
In any week I can work in oncology, I can work in medical, surgical or medical assessment unit. So I really enjoy the opportunity that All Staff has given me to be able to expand my nursing skills while I'm still learning.
And I love working for All Staff. I've been with them for 10 years.
As an agency nurse working in a hospital, I find that you're greatly appreciated. People would be working short if there weren't agency nurses.
We are applying to become a registered training organisation, so we can then provide face-to-face training for our nurses.
Before I was working at All Staff, I was studying at the University of Newcastle. I was studying my Bachelor of Nursing, and I was speaking with a few students and they recommended joining up with All Staff. So I put my resume in and a few days later I got a phone call to come in and go through the particulars, and next minute I had work.
I have mainly chosen the field of working in night shift and in the emergency department. I previously had orthopaedic experience and medical surgical, so I enjoy being in the emergency department because it throws me a good mix of all of that.
We also provide drug and alcohol testing training to some of our select nurses, and that training enables them to provide on-site testing for alcohol and drugs of abuse for workplaces. So a number of our nurses have taken the opportunity to attend this training, and as a result, it's increased their work opportunities.
Budgets and finite funding will continue to place pressure on the delivery of health services in Australia. while a perpetual focus will remain on achieving reform through the reduction of cost and healthcare delivery. The generational challenge will be to adopt innovative approaches that enrich the patient experience and ensure a robust and sustainable healthcare system for future generations.
When you go to work as an agency nurse, the best thing with it is the variety and gaining experience in a large amount of areas of nursing, which is useful in any area that you're working in.
Always get treated well when I go to work. The staff seem to recognise that your agency and show you around and make you feel comfortable before the start of the shift, and always makes it for a good day.
Working as an agency nurse, I get to work in areas that I do really enjoy, particularly in the hospital setting. As a university student, it's really good.
Here at All Staff, we support our nurses to continue their ongoing education. So quite often a nurse will come to us with ideas of courses that they would like to do, and we'll support them to do that however possible.
I can work morning, afternoon or night shift. So generally when I walk onto a ward, I introduce myself. I'm really terrible at remembering people's names, but I always introduce myself. I orientate myself to the ward. I work out where the important stuff is, where the drugs are, where the dressings are, that sort of stuff. Get handover and always say g'day to my patients. Let them know that I'm there and I'm available for anything they need. And then after that, anything can happen.
I became a nurse firstly because I wanted something to do, but I enjoy it, and that's why I stay a nurse.
All Staff has furthered my skills, and one of these areas would have to be with drug and alcohol testing. I really enjoy drug and alcohol testing. It gives me new opportunities. I travel a lot with it.
Being an agency nurse, I can choose the shifts I want to work. I have every Friday off so I can spend it with my daughter. If we want to go on holidays, we can. I don't have to put in for holidays. That's what I enjoy most about it, the freedom.
Nursing agencies will continue to be an integral part of this reform, and our belief is that the medium to long-term sustainability of Australia's healthcare workforce relies heavily on putting in place innovative practices that keep trained and experienced staff working in healthcare, which provide the best outcomes for patients and workers alike. 27% of HHG's workforce is in the 45 to 54 age bracket, followed by the 55 to 64 age group at 21%. The 25 to 34 age group equals 18%, and 35 to 44 age group equaling 17%. Then comes the 19 to 24 year age group at 14%. Interestingly, the 65 to 74 year age bracket represents 3% of the workforce.
I'm Alicia Gooley and I'm an All Staff nurse.